This is Dr. James with Helpmommy.com, and we are right in the middle of croup season. So what is croup? What causes it? And what do you need to know about it? What can you do? When do you need to see a doctor? So croup is a syndrome, really. It can be caused by multiple different viruses. It can be caused most commonly by a virus called parainfluenza. It can be caused by the flu virus, influenza, and it can be caused by RSV. And it's an upper respiratory tract infection that affects mainly the upper large airway. And instead of normally causing lots of runny nose that drains down the back of your throat and then you cough that back up, this cough is actually caused by swelling in the airway. And that's what causes its very characteristic cough. It has a barking cough. And when we call a barking cough, a lot of times people think a barking cough is one that's really phlegmy and chunky. That's not what doctors are going to call a barking cough. We're going to call it a barking cough, a very hoarse cough, much the same as like what you see with a barking seal. And it's going to have this very distinctive sound. And then it progresses and gets worse, and the swelling gets worse, especially at the level of vocal cords, you're going to have problems breathing in. And this is going to cause a sound called stridor. Now, the croup, because it's causing swelling in your airways, it's always going to be worse on kids who have the smallest airways, because when it's smaller around, it's easier for swelling to occlude it. Whereas when the airways get bigger, you don't have as much problems. And so croup is going to be a lot more scary in the younger babies and gets less scary as they get older. Doesn't mean you can't still get croup. It's just not going to be as bad. It's going to hit you all of a sudden usually. It's going to be like 1, 2 o'clock in the morning, and all of a sudden you suddenly have this barking cough. The same thing with the stridor. It's going to happen in the middle of the night. Croup is always worse between the hours of 9 p.m. and about 6 or 7 o'clock in the morning. And the reason for that is our natural steroid goes down during the night. Well, steroids reduce inflammation and swelling. So when our steroid goes down, swelling can go up. And that swelling in the airway goes up, and then that's what causes the problem. You're going to have this terrible, scary coughing and breathing during the night, and then you get to where you can actually go to your doctor and they'll look fine. And so as a doctor, we have to treat not just what we see, but also the history of the story that you're telling us. It's usually going to last anywhere from 5 to 10 days. It's very front end loaded, and it's much worse the first 3 or 4 days. If you have this barky cough, it responds best to humidity. So we'll tell you to go in the bathroom and steam up the shower. We'll also have you run like a humidifier or a vaporizer right beside the baby, because that humidity will help. Also cold air. So sometimes we'll have you open the freezer and have them breathe that cold air. Or if it's cold outside, take them outside and let them breathe the cold air. And that cold air will decrease some of the swelling. Really, if you start to hear that stridor, and it's happening with every breath, and you've tried the steam and it didn't calm them down, you really need to go to the emergency room. And chances are it's going to be the emergency room, because that's the only one that's going to be open at this time of night. What we're going to do is a couple things. They'll probably get a dose of steroids. That's the real treatment. They may get a breathing treatment of something different than what we use for like asthma. It's called racemic epinephrine, and it will instantly reduce the swelling in the airway. It's not very long lasting, so it's not something you're going to get a prescription with to take home. We're basically just hoping we can reduce that swelling until the steroid takes effect, and then you don't have any problems breathing. So if you have that stridor and it's more than just 1 or 2 times and it's happening with every breath, it's extremely scary. You definitely need to go see a doctor, and this is going to be much more likely when you have a very small child. As the croup progresses over the first several days, the cough's going to change, and it's going to go from that barking sounding cough to more a chunky sounding cough, bringing stuff up. That's actually reassuring. It's almost like when the cough sounds worse, croup is getting better. So I hope that helps you with croup.